Assalamualaikum. Today we study with part 7 of Autocoids. At the end of this e-learning session, you are able to learn why prostaglandin, thromboxane and leukotrienes are called as eicosanoids. Secondly, discuss synthesis of eicosanoids, and lastly, explain pharmacology and pathophysiological role of eicosanoids. So let's start with the first learning outcome, that is why prostaglandin, thromboxane and leukotrienes are called as eicosanoids. So let's see the reason. So the reason it is behind their synthesis and chemistry. So let's see how it is synthesized and what is the chemistry of these three important eicosanoids. So remember that in the body, prostaglandin, thromboxane and leukotrienes are all derived from Eicosa, tri, tetra, penta, enoic acid. So if you see the basic structure, so the basic structure, that is Eicosa and enoic acid, it remains the same. Whereas substitution may change, like it may be the tri, it may be the tetra, or it may be the penta enoic acid, isn't it? So since their basic structure of Eicosa and that is enoic acid, since it remains the same, so based on their process of synthesis or based on this chemistry, they are collectively called as eicosanoids. So this is the reason why prostaglandin, thromboxane and leukotrienes, they are collectively called as eicosanoids. So these are the autocoids belong to the category of the eicosanoids. These are most widely universally distributed autocoids in our body. It means they are not present only on particular cell. Like we have seen in case of 5-hydroxytryptamine, it is predominantly present in your intestine. Some amount it is present in the central nervous system, isn't it? So the location it is defined. Whereas in case of eicosanoid, there is no defined location. It is most universally distributed autocoid in the body. It means each and every cell of the body, it is capable of producing eicosanoids. So that is the beauty of the eicosanoid, that every cell of the body can produce the eicosanoid. Okay. So this is about the chemistry and synthesis of the prostaglandin, thromboxane and leukotrienes. For detailed synthesis, you refer the KD Tripathi textbook. So there they have given the figure. Also they have given the chemical structure and how the chemical structure is the change in presence of different enzyme, and it lead to the synthesis of prostaglandin, thromboxane and leukotrienes. So I don't want to take that at this moment, so you can take that as assignment and you can study at your home. Okay, but we'll see the basic portion of the synthesis. Okay, so how it is synthesized and which enzymes are basically involved in the process, so that we'll see in today's lecture. So let's start with the synthesis part. So the practically, as I have mentioned, every cell and the tissue is capable of synthesizing one or more type of prostaglandins or the leukotriene. So every cells and tissue is capable of synthesizing it. Okay. So as far as synthesis is concerned, the synthesis of eicosanoids, takes place by two major pathway. So first pathway, it is cyclooxygenase pathway, and second pathway, it is lipooxygenase pathway. And remember that its name itself indicates, so anything which is end with genase or NASE, that is nase, it indicates that it is the enzyme. So these are basically enzyme or intermediate catalyst which are responsible for converting their precursor into the intermediate product or into the final product, right? So when you see the list of the prostaglandin are mentioned as the E2, they are I2, they are F2. So some of these prostaglandin are intermediate prostaglandin. These are not a final prostaglandin, right? Or these are not an end product of the prostaglandin synthesis. So end product may be something else. So some are intermediate prostaglandin which are synthesized in presence of different enzymes. So very important enzyme are two, that is cyclooxygenase and lipooxygenase. So any prostaglandin, if it is synthesized by the cyclooxygenase, right, so it means it is synthesized by cyclooxygenase pathway. So those prostaglandin or those eicosanoids which are synthesized by lipooxygenase, so it means they are synthesized by the second pathway, that is lipooxygenase pathway. Now let's see what happens when these eicosanoids are synthesized by first pathway, that is cyclooxygenase. So when the cyclooxygenase pathway it start working, in this case it will generate the eicosanoid with the ring structure. right? So there are many eicosanoids. So these eicosanoids, some are the ring structure, and some of the eicosanoids, they does not having the ring structure. It means they having straight chain molecules. They are having the carbon and hydrogens and different substitution on their group, but those are the straight chain. So there are some are ring structure. So all those ring structure eicosanoids, they are synthesized by the enzyme called as cyclooxygenase, or they are synthesized through cyclooxygenase pathway. So what are those ring structure eicosanoid? Example, prostaglandin, thromboxane and prostacyclin. So easy to remember. So you can easily remember prostacyclin because it ends with suffix cyclin. So it indicates it is the cyclic ring. Okay. But prostaglandin and thromboxane, they are also having the ring structure. So these are the three eicosanoids which having the ring structure, and they are synthesized in presence of cyclooxygenase. Now second pathway, it is the lipooxygenase pathway. So lipooxygenase pathway, it produces open chain compound. It does not produce the ring structure compound, it produces the open chain compound. And what is the example of open chain compound? All leukotrienes. So different leukotrienes, leukotriene 1, leukotrienes 2, leukotriene 1A, leukotriene 1B, right? So all the leukotrienes, they having open chain structure, and these open chain structure, it is synthesized by lipooxygenase pathway in presence of enzyme lipooxygenase. Okay, so to summarize, cyclooxygenase, it will generate eicosanoid with the ring structure. Example, prostaglandin, thromboxane and prostacyclin, while lipooxygenase pathway produces the open chain compound, and only one eicosanoid having open chain compound, it is the leukotrienes. So this is all about the synthesis of eicosanoids. Now let's see about the inhibition of synthesis of eicosanoid. What are the drugs which can inhibit different eicosanoid? So synthesis of the COX, that is cyclooxygenase, it can be inhibited by non-steroidal anti-inflammatory drug, that is the NSAID, and this we have studied in detail in analgesic chapter. Okay, so synthesis of the COX, that is cyclooxygenase, it can be inhibited by NSAID, that is non-steroidal anti-inflammatory drug. But remember that NSAID do not inhibit the production of leukotriene. What is the reason why it doesn't inhibit the production of the leukotriene? So just now we have seen the leukotrienes are synthesized by the enzyme called as lipooxygenase. It is not synthesized by the COX. It is not synthesized by the cyclooxygenase. So it is synthesized by the LOX. So I write it that lipooxygenase as the LOX, and COX, it is your cyclooxygenase. So leukotrienes are synthesized by the lipooxygenase, and since NSAID, it does not inhibit lipooxygenase, it will not able to inhibit production of the leukotriene. So remember that the prostaglandin, thromboxane and prostacyclin can be inhibited by the non-steroidal anti-inflammatory drug, but leukotrienes cannot be inhibited by non-steroidal anti-inflammatory drug because leukotriene are synthesized by the enzyme called as lipooxygenase, which is not inhibited by the NSAID. So this is the reason. Now let's see what is that category of the drug which can inhibit all type of eicosanoid. It means it is capable of inhibiting both the enzymes cyclooxygenase as well as lipooxygenase. So such category of the drug are the glucocorticosteroids. So these are the steroid. So glucocorticosteroid, it inhibit release of arachidonic acid. Now this arachidonic acid, it is the precursor of all eicosanoid. No matter whether it is thromboxane, it is the prostaglandin, prostacyclin or leukotriene, the arachidonic acid, it is their precursor. It means all eicosanoids, they are synthesized from the arachidonic acid. Whether it is cyclic or open chain eicosanoid, all are synthesized by the arachidonic acid. Since glucosteroid, it inhibits this precursor, that is arachidonic acid. Since precursor it is inhibited from the membrane lipid, indirectly it reduces the production of all eicosanoids like prostaglandin, thromboxane as well as leukotriene. So if you want to inhibit all type of eicosanoid, the category of the drug you can select, it is the glucocorticosteroid. It depends upon the disease, what type of disease person is suffering from and which eicosanoid it is responsible for that disease. You can select appropriate category of the drug for the treatment of that particular disease. Whereas if the disease it is related to only prostacyclin, prostaglandin and thromboxane, then yes, obviously you can go for treatment of those disease by non-steroidal anti-inflammatory drug. Okay, so for selection of appropriate medicine, you must know the role of prostaglandin or role of eicosanoids, especially in the disease. So you must know their pharmacological action as well as their pathophysiological role. So let's see the pharmacological action and its pathophysiological role, how it's play important role in many disorder, what it does with different systems and the tissue. So first we will not directly jump to the pharmacological action or their pathophysiological role. First we will see what are those factors which determine pharmacological action and pathophysiological role of eicosanoid. So the cyclic eicosanoid, it produces wide variety of action, right? And what are the cyclic eicosanoid? So there are three cyclic eicosanoid we have seen. First one it is the prostaglandin, second one it is the thromboxane, right? And third one it is prostacyclin. So these are the cyclic eicosanoid. So cyclic eicosanoid, it produces wide variety of action and it is depends on particular factor. Let's see what are those factors on which the action of cyclic eicosanoids it's depend. So the first factor, it is the particular prostaglandin or thromboxane. For example, if you just take the example of the prostaglandin, so the prostaglandin, the short form it is written as the PG. Thromboxane short form it is the TX. So don't get confused. So henceforth we will be using this short form. So TX means thromboxane and PG means prostaglandin. So let's take the example of the prostaglandin. So prostaglandin, there are different types. For example, prostaglandin I2, prostaglandin F2, prostaglandin E2, prostaglandin H2, right? So depending upon particular type of prostaglandin, their action may change. Maybe somewhere prostaglandin I2 may produce the contraction, whereas some at the same tissue, some other prostaglandin, other type of prostaglandin, it may produce the dilatation. So these are all opposite effect depending upon the type of prostaglandin. Okay, so the first factor, it is the particular type of the prostaglandin. Second one, it is the species on which you test these eicosanoid, isn't it? Suppose if you change the species for testing this eicosanoid, their pharmacological action will also change, because every species having unique biological composition. So based on this biological composition, their pharmacological action on those tissue or those species also change. So it is depend upon the species on which it is tested. It is also based on the tissue on which you test, whether it is it is the longitudinal muscle of the GI tract or it is circular muscle of the GIT. So based on the different tissue also, it may show different pharmacological action, and we are going to see that in a detail when we study the pharmacological action and their pathophysiological role on different tissue. Likewise, if there is change in hormonal status, right, it also change their pharmacological action. So hormonal status, it may change in a disease, and like for example in diabetes, which hormone it is deficient, insulin deficiency is there. Likewise in case of hypothyroidism, that there is deficiency of the thyroid hormone. But in most of the cases, in case of the pregnancy, there is a sudden change in hormones occur, which is unpredictable sometimes, isn't it? Like in case of, if patient suffering from the diabetes, then you can predict, yes, their insulin level will be reduced or their insulin level will be less. You can undergo the testing, you will come to know what is the level of that hormone. But when patient is the pregnant, if she is a female and she is the pregnant, right, there is wide variety of the hormones which are released by the body. So remember that the action of this cyclic eicosanoid, it also change with change in hormonal status of your body. So any disease or physiological condition, so disease means like diabetes, or physiological condition means pregnancy. So any physiological condition or disease which change the hormonal status will also change pharmacological action of the cyclic eicosanoid, and we'll see this in detail when we study the effect of drugs on uterus. Okay, so this is all the factor which affect the pharmacological action of the cyclic eicosanoid. Now another important parameter, it is the prostaglandin, they differ in their potency. Like all are the prostaglandin, like PGE2 is the prostaglandin, PGI2 is the prostaglandin, PGD2 is the prostaglandin, all are the prostaglandin, but depending upon their type, some are more potent whereas some are less potent. We'll also see the example belong to this category. Okay. Lastly, different prostaglandins sometimes have opposite effect. So although the category it is prostaglandin, but PGE2 somewhere it produces the constriction, whereas PGI2 at the same tissue it produces the dilatation. So although they are belong to the category of the prostaglandin, but since their type is different, so they produces the opposite effect on the same tissue. So we'll be witnessing the example belong to all these categories. So it will be very clear to you about the different factor which affect the pharmacological action and pathophysiological role of cyclic eicosanoid. So now we'll start with the pharmacological action of eicosanoids on different tissues. So let's start with cardiovascular system. So what is the action of eicosanoid on the cardiovascular system? So remember that the action on the cardiovascular system, it is depend on the type of the prostaglandin. So we are starting with the prostaglandin and the thromboxane, and leukotriene we will see later on. So in next lecture we will study in detail about the pharmacological action of the leukotriene. So on the cardiovascular system, depending upon the type of prostaglandin, it shows different action. For example, if it is PGE2, so you must remember, so whenever you are studying the pharmacological action or role of this eicosanoid on pathophysiology, you must remember what type of prostaglandin it is, whether it is E2 or F2. So prostaglandin E2 and prostaglandin F2 alpha, they causes the vasodilation, okay, whereas prostaglandin I2, if you see their action, so prostaglandin I2, it is more potent vasodilator as compared to prostaglandin E2. So prostaglandin E2 we have already studied and we know that it is vasodilatory in nature, but if you compare their vasodilatory action with prostaglandin I2, then you will come to know that the prostaglandin I2, it is more potent vasodilator as compared to prostaglandin E2. So when prostaglandin I2 is given or when it is synthesized in body, due to their potent vasodilatory action, it reduces the blood pressure. Okay, so the blood pressure it is reduced and it is capable of producing the hypotension in that particular person. So we have seen one of the factor that depending upon type of prostaglandin, the potency of prostaglandin or eicosanoid it change. So that is proved over here. That is PGI2 it is more potent, so it is different type, so it is more potent, whereas PGE2 it is less potent, right? So that factor it is proved. So this is the first action. Second action, thromboxane, it consistently produces the vasoconstriction. Now just look at here, it is the eicosanoid, thromboxane and prostaglandin both are eicosanoid. But what is the action of the thromboxane? It produces the vasoconstriction. Whereas the prostaglandin, all prostaglandin, they are producing the vasodilation. Their action or their potency may be different depending upon different type of prostaglandin. But remember that they produces the vasodilation. Whereas thromboxane A2, it can consistently produces the vasoconstriction. So instead of decreasing the blood pressure, what it may do? It may increases the blood pressure. Because due to vasoconstriction, it produces increase in the blood pressure. So this is just exactly opposite action depending upon different type of the eicosanoid. Likewise, very interesting action, it is seen with prostaglandin endoperoxide. Now first you try to understand what is endoperoxide. So endoperoxide are the prostaglandin which are synthesized during intermediate step. What is the intermediate step? Like from the precursor, they are converted into the endoperoxide, and this endoperoxide will be further converted into final prostaglandin. So there are two such endoperoxides are there in prostaglandin G2 and prostaglandin H2. So you must remember prostaglandin G2 and H2 are the endoperoxide. It means they are synthesized during the synthesis of the prostaglandin as an intermediate step. So they are synthesized in between the synthesis of the prostaglandin. Okay. And the characteristic of these is that it having peroxide structure. What is peroxide structure? Which is also present in hydrogen peroxide. It consists of two molecules of the oxygen, right? So there is two molecules of the oxygen which breach the cyclic ring of the endoperoxide. So since it having this peroxide structure and they synthesize in between the step of the synthesis of the prostaglandin, they are called as endoperoxide. So what is the example of endoperoxide? Prostaglandin G2 and prostaglandin H. So if you see their pharmacological action, they are inherently vasoconstrictor in nature. So what is their inherent action? Inherent action means their original action it is vasoconstrictor, right? But what is the problem in such case? Since they are endoperoxide, their structure doesn't remain the same. They are further converted into some other structure, isn't it? So when they are converted into other structure, and that when that other structure it is produced, the same prostaglandin it produces the vasodilation, because now it doesn't remain as the same prostaglandin since it is converted into other prostaglandin. So their structure it is changed, and whatever structure is formed, it is capable of producing the vasodilation. Okay, so prostaglandin endoperoxide, that is G2 and H2, when they synthesize initially, they produces vasoconstriction, and when they transform it into the other compound or other prostaglandin, those prostaglandin can produces the vasodilation. So you can see the two-phase response. So it is called as a biphasic response, both vasoconstriction as well as the vasodilation. It is due to rapid conversion of PGG2 and PGH2 into other prostaglandin, which is responsible for their vasodilatory action. So this is interesting action of prostaglandin on cardiovascular system. Now let's see what is the action of prostaglandin is on the platelets. Okay, so platelets are very important, and we know that the 5-hydroxytryptamine, then many autocoids, they are having very intense action on the platelets. So we have seen 5-HT, it is the pro-aggregatory in nature, means it produces the aggregation of the platelets. It's also play a role in forming the blood clot and limit the loss of the blood in case of the cell injury, isn't it? So likewise, there is also important role in case of these eicosanoid. So let's see what is their role. So thromboxane A2, it produces locally by the platelets. So, and once it is produced, what it does, it is the potent inducer of aggregation and release reaction. Now what do you mean by the aggregation? The moment thromboxane it is released by the platelets, okay, what will happen? It will produce the certain chemicals. When it produces certain chemical, it is called the release reaction. And these chemical, when it release, it will attract more platelet at the site where there is release of the thromboxane, isn't it? So wherever thromboxane it is released, it will attract more platelets, and due to the attraction of those platelets, what will happen? That there will be the platelet aggregation and there will be formation of the blood clot. So thromboxane A2, it produces locally by the platelet, and it is potent inducer of the aggregation and release reaction. And we have seen their role in ischemic heart disease, when more level of 5-HT, 5-hydroxytryptamine and thromboxane, when it is released from the body, what it does, it produces the blood clot, and this blood clot, it may block the blood supply to the heart, and it may lead to ischemic heart disease. The patient may suffer from angina pectoris, and sometimes he may suffer from minor heart attack or major heart attack as well, depending upon the size of the blood clot, or depending upon how much the blockage is there in case of coronary artery. So this is very important role of thromboxane A2, right? Then we'll see the role of the endoperoxide. So what are the endoperoxide? Just now we have seen it is the PGG2 and PGH2. So these are the endoperoxide. So they are intermediate prostaglandins. They are pro-aggregatory in nature. It means pro means it may produce the aggregation. Okay, so they are pro-aggregatory in nature, and anti-aggregatory means it will inhibit the aggregation. So pro means it induce the aggregation, whereas anti, it means it inhibit the aggregation. So endoperoxide, they are inducer of aggregation. Since they induce the aggregation, they are called as pro-aggregatory in nature. Whereas other prostaglandin like PGI2, so this is other prostaglandin, it is generated by vascular endothelium. What is the endothelium? Endothelium, it is the innermost layer of the blood vessel. So it is the innermost layer of the blood vessel. So since they are released by innermost layer of the blood vessels, so when they are generated, what it does? These are the potent inhibitor of the platelet aggregation. Now just look at the category is same. Both are prostaglandin. So prostaglandin G2, H2, prostaglandin I2, these are all prostaglandin, but since they have a different type, they are having opposite effect. So endoperoxide G2 and H2, they are pro-aggregatory, whereas PGI2, it is the potent inhibitor of the platelet aggregation. So you can see everywhere you can see the biphasic response, isn't it? Because endoperoxide are rapidly converted into other stable prostaglandin. So when endoperoxide is present, produces the pro-aggregation, or they are pro-aggregatory in nature, or when they are converted into other compound which is stable like prostaglandin I2, right? It is the potent inhibitor of the platelet aggregation. So this is a very interesting action on the platelets. Whereas PGD2 also having anti-aggregatory action, but interestingly PGD2 it is less potent as compared to PGI2. So to summarize, the thromboxane they are pro-aggregatory in nature, and endoperoxide G2 and H2 they are pro-aggregatory in nature. PGI2 and PGD2 these are anti-aggregatory in nature. Out of this PGI2 it is the more potent. So PGD2 it is the less potent as compared to PGI2. So this is the effect of prostaglandin on the platelets. Let's see effect on the uterus. So uterine contractions, and here we'll see one of the important factor of hormonal change, right? And we'll take the example of the pregnancy, because uterus play a very important role in case of the pregnancy. Okay, so uterus it produces the constriction. So prostaglandin E2 and prostaglandin F2 alpha. So prostaglandin E2 and prostaglandin F2 alpha. So you must remember. So it is very important to remember type of the prostaglandin whenever you explain their pharmacological action, because depending upon different type of prostaglandin, their pharmacological action is changed. So prostaglandin E2 and F2 alpha it uniformly contract human uterus. So there is uniform contraction of human uterus. It is produced by prostaglandin E2 and prostaglandin F2 in pregnant as well as non-pregnant women. So when you do in vivo study or when you give the injection of prostaglandin E2 and F2, no matter whether that woman it is pregnant or non-pregnant, it uniformly produce the contraction of both the uterus, pregnant as well as non-pregnant uterus. Whereas other prostaglandin, it having the different action. But remember that the sensitivity of these action, the sensitivity of the action of the prostaglandin on the uterus, it is depend upon the pregnancy. So the sensitivity it is higher during the pregnancy, right? It means both produces the contraction. In case of pregnant as well as non-pregnant uterus, they produces the contraction. But remember that if you give the same dose in case of the pregnancy and during the non-pregnancy, then same dose it produces higher level of contraction in case of the pregnant uterus. So in case of those women who are pregnant, the same dose of these prostaglandin it produces the higher effect, right? And interestingly, it further modest increase with progress of pregnancy. It means as pregnancy it is progress, means it's progress from the 3 month to the 6 month, and from 6 months towards the final trimester, that is the 9th month. So as it is going ahead, their sensitivity it is keep on modestly increasing. So it keep on increase the sensitivity of this prostaglandin during the pregnancy. So this is here we have proved that the effect of the prostaglandin or effect of the eicosanoids it may change with the change in the hormone, because what changes occur during pregnancy? The change it is occur in the hormone. Since there is changes occur in the hormone, their sensitivity it is keep on increasing with the progress of the pregnancy. So it is as pregnancy is progressing, the sensitivity of the prostaglandin E2 as well as F2 it also keep on increasing. Okay, so this is very interesting effect of prostaglandin on the uterus. So point to be remember here, there are two prostaglandin you must remember which is related to uterus, that is the E2 and the F2 alpha. Okay, so E2 and F2 alpha. So these are the two prostaglandin which produces the constriction of the uterus, and uniform constriction on both pregnant as well as the non-pregnant uterus, but their sensitivity is higher during the pregnancy. It further modestly increase with the progress of the pregnancy. Now let's see what is the action on the bronchial muscle. So we have seen all 5-HT, histamine, it is also the autocoid, it produces the constriction. Now let's see what is the effect of the eicosanoid on the bronchial muscle. So the prostaglandin F2 alpha, now you must remember the name, it is the F2 alpha, prostaglandin D2 and prostaglandin A2. They are potent bronchoconstrictor, and even they are more potent as compared to the histamine. So these prostaglandin, if they are released in the bronchi, they produces very potent constriction of the bronchi, and it may complicate the asthmatic situation, and we will see at the end. Okay, whereas prostaglandin E2 it is the powerful bronchodilator. Now just look at all 4 are prostaglandin. But prostaglandin F2, D2 and A2, they are potent bronchodilator, whereas prostaglandin E2, it is powerful bronchodilator. Likewise, prostaglandin I2, it is also bronchodilator, but it produces a mild bronchodilatory action, isn't it? So whenever you come across the pharmacological action where any drug or any autocoids or any biological compound, if it produces bronchoconstriction and bronchodilation, then you must also study those compounds with reference to the asthma, isn't it? That is very important. For example, if patient suffering from the asthma, you can explore prostaglandin E2 and I2 for the treatment of the asthma because it produces the bronchodilation. Whereas you can explore prostaglandin F2 and D2 and A2, right? What is their role in asthma? So you can see whether they are released in asthma. If they are released in asthma, you can use the antagonist of this for the treatment of the asthma, isn't it? So their role it is studied, and it is observed that in case of asthmatic patient are more sensitive to the bronchoconstrictory action of these prostaglandin, that is F2, D2 and A2, as well as they are also sensitive to the bronchodilatory effect of the prostaglandin E2 as well as prostaglandin I2. It means if you give this prostaglandin in case of asthmatic patient, it produces very good bronchodilation and it may relieve that patient from the asthma, right? But this is not only sufficient to evolve these prostaglandin as a drug, because it may having some other side effect. So those side effects are also need to be evaluated, and then only you can say that this can be used for the treatment of the asthma. Okay, so we have seen the role of different eicosanoid in case of bronchial muscle. So some of these eicosanoid, they are potent bronchoconstrictor, even more as compared to histamine, whereas PGE2 and I2, they are bronchodilators. Out of this, PGI2 is the mild dilatory action. But remember that in case of asthmatic patient, both action, that is the bronchoconstrictory and bronchodilatory action, the asthmatic patient are more sensitive to these actions. Okay, so we have seen the action on the bronchi. Let's see what is the action on the GIT. So in case of GIT, the study it is done on in two ways. One, it is on isolated preparation. So when you have isolated the GIT preparation, like you isolate the cock ileum, right? Cock ileum you isolate, you put on the tissue bath, you give the acetylcholine and observe their pharmacological action. So like that, when this GIT was isolated and you take a different type of isolated preparation, maybe you know that in case you might have studied this in anatomy, the GIT having two types of muscle. One, it is longitudinal muscle and other are the circular muscle. So when if isolated preparation which is longitudinal muscle, so which having the longitudinal muscle of the gut, when it is studied, it is observed that PGE2 and PGF2, it produces the contraction of the longitudinal muscle of the gut. Okay, so longitudinal muscle, what is the action? It produces the contraction, PGE2 and the PGF2. Secondly, while you study their effect on circular muscle, it is observed that some of prostaglandin produces the contraction and other produces the relaxation. For example, PGF2, right, which produces the contraction in longitudinal muscle, it also produces the contraction in the circular muscle. So you can see PGF2 produces the contraction in the circular muscle. So in the both the muscle, longitudinal as well as circular muscle, PGF2 produces the contraction. Whereas PGE2, in longitudinal muscle, what is the action? It produces the contraction. But when you study the action of PGE2 on the circular muscle, it produces the relaxation. So exactly opposite. Okay. So to summarize, on isolated preparation, both PGE2 and F2 they produces the contraction. Whereas in circulatory muscle, only PGF2 produces the contraction, whereas PGE2 it produces the relaxation. So this is the action on the isolated preparation. Now, what is the action on in vivo tissue? So when you give the injection of the prostaglandin, maybe through the IV injection, what it action produce in human body? Or if you give it to the rat, what it action produce? So when you have given this drug, especially when you have given the PGE2, it is observed that it increases the propulsive activity. What is the propulsive activity? Suppose if this is the intestine, and intestine consists of GIT content. Okay, so GIT content, it means it consists of mostly the fecal matter. Okay, so what GIT does? It actually propel food from your stomach to the small intestine and from small intestine to the large intestine. Since it enhances this propulsive activity, so propulsion it become very fast, right? So the fecal matter it is going quickly into GI tract. So what will happen due to that? Which disease it may produce? It may produce the watery diarrhea, because there is the quick movement is occur, so there is no chance for absorption of the water and nutrient into the systemic circulation. So it produces the watery diarrhea, and secondly it will also produces the colic. What is the colic? When you suffer from the pain of the GIT, it is called as the colic. And you might have experienced when anyone is suffer from the diarrhea, if he is suffering from watery diarrhea, he suffer from very severe pain in your intestine, that is called as the colic. So the colic and watery diarrhea are the important side effect of prostaglandin E2, right? So we have seen their role in case of the asthma, but we cannot explore it. Why? Because it having the side effect. So it may produce a very severe colic, watery diarrhea. Okay, so which are the side effect on the GI tract. So we have seen the role on the GIT. Let's see what is the role in the kidney. So very interesting role it plays in case of the kidney. PGE2 and I2, what it does, it increases the water, sodium and potassium secretion. So since it increases water, sodium and potassium excretion, so what is their overall action? So overall action, they are diuretic in nature, isn't it? So like they having the effect like furosemide, which is the potent diuretic in nature. Whereas prostaglandin E2 has shown to have furosemide like inhibitory effect on the chlorine reabsorption. So what it does, furosemide it is the loop diuretics. It is a potent diuretic in nature. Okay, so what it does, it increases the excretion of the water, increases the excretion of the sodium, increases the excretion of the potassium, but at the same time it produces the inhibitory effect on the chlorine reabsorption. So if reabsorption is inhibited, what will happen to this? So if reabsorption is not there, obviously it will also increases the excretion of the chlorine. So what is overall effect? Overall effect is increase the excretion of water, sodium, potassium and the chlorine. But it is due to indirect effect. What is that indirect effect? It is through the inhibition of chlorine reabsorption. Since there is no reabsorption, the chlorine will also excreted along with the water, sodium and potassium. Okay. So this is the effect of the prostaglandin E2. They cause renal vasodilation. Now how it is related to their diuretic action? What will happen due to the renal vasodilation? Due to renal vasodilation, the more blood supply will occur to the kidney. And if there is more blood supply to the kidney, what will happen to the urine formation? So more is blood supply to the kidney, more will be the urine formation. Less is the blood supply to the kidney, less will urine formation, right? So they produces the renal vasodilation, thus increases the diuretic action, and also it inhibits tubular reabsorption. So if anything which is reabsorbed from the tubule will not excrete it into the urine. Since they inhibit tubular reabsorption and they produces the renal vasodilation, so overall action if you see, it produces very potent diuretic action. And what is the reason? It produces renal vasodilation, it increases the blood supply to the kidney, it inhibits tubular reabsorption. Since there is no reabsorption, everything will be excreted from the urine. Interestingly, other action it is also there, that is prostaglandin I2, E2 and D2, it also evoke release of the renin. And you know the important role of renin-angiotensin system. I am not going into detail of this. So at this moment you just remember it evoke release of the renin. So overall, if you see effect of the prostaglandin, different prostaglandin on the kidney, what is their overall effect? The overall effect, they are diuretic in nature. So they produces very potent diuretic action on the kidney. Last effect we will see on the central nervous system. So on the CNS, remember that when you give the IV injection of the prostaglandin, it penetrates brain poorly. So there is very poor penetration it is there on the brain. So through the IV injection, the central effect are not prominent. So you cannot study central effect by giving IV injection. And we know if we cannot study by IV injection, what we need to do is, we need to give the intracerebroventricular injection. Like you need to give the injection in cerebrospinal fluid. So when you give directly injection to cerebrospinal fluid, there is no matter of crossing blood-brain barrier. It will directly go into central nervous system. So when you give such injection, you can observe their pharmacological action. So when it is given through intracerebroventricularly, it is observed that it produces the sedation. So what is the action on the CNS? CNS it is inhibited. It produces the rigidity, so it also having action on the motor neuron which control the movement, so produces the rigidity. It produces the behavioral change, so there is change in a behavior. It also having action on the thermoregulatory center. What it does, it produces a rise in a body temperature, so they are pyrogenic in nature. So all those biological compound or any drug which increases the fever, they are called as pyrogenic. Okay, but interestingly, thromboxane A2, it is not a pyrogenic. So prostaglandin mostly they are pyrogenic, and we have seen their role in case of antipyretic effect. What paracetamol does? Paracetamol inhibits cyclooxygenase, right? It inhibits the COX enzyme, and since it inhibits the COX enzyme, it can control increase in body temperature, and that is the reason why we are using NSAID as a antipyretic drug, because they are capable of inhibiting cyclic prostaglandin. They are capable of inhibiting cyclooxygenase, and they inhibit all those prostaglandin which increases the body temperature. So these are the interesting effect on the central nervous system. So I have done with my today's session. So thanks for watching my session. If you like my session, then do remember to give me a thumbs up.